Hello and welcome to TNIE Online. I am Chetna Belgere. And today with us we have Dr. V Ravi, renowned virologist, heading the Genome Sequencing Committee of Karnataka, former head of the Department of Neurovirology at NIMHANS, head of research and development, Tata Medical and Diagnostic Center. He's here to speak to us on the Omicron situation in Karnataka today. So last time we spoke, you had called Omicron as Usain Bolt amongst the SARS-CoV-2 variants. And we did have very little information of the variant then. Today, what do we know about this so-called gentleman variant Omicron, sir?
Thank you, Chetna, for having me again. From the last time we met, we have much more information on Omicron. The virus has now spread across to more than 100 countries. And in India, as you have seen, it is causing a large number of infections in major metros as of now. Today, I think India recorded over 250,000 COVID cases. And we also know from genomic sequencing results, although it's a small proportion, that Omicron has taken over in major cities like Mumbai, Delhi, and Bangalore. More than 60 to 80% of cases, the range varies, is Omicron in sequencing in the last 2 to 3 weeks. The good news, though, among all this huge surge is that most of the patients who have got Omicron have had mild illness. And I think vaccination has helped in a big way to minimize the severity of the disease and drastically reduce mortality. We know from United States of America, which is going through a very rough phase at this point of time, that hospitalizations and deaths are predominantly in the unvaccinated. To that extent, we in India are much more fortunate because over 100 crore people have received at least one dose of the vaccination. And in many parts, close to 60 to 80% of people have received the second dose as well. So this is the current situation of Omicron. It still remains Usain Bolt of all variants.
Okay. So considering, like you said, it is mostly the unvaccinated who are ending up in hospitals, and Karnataka that way has done quite a good in terms of vaccinating its people with both the doses. I think we're pretty good when compared to other states. But we have had some of the major political rallies recently. At the time when we were just seeing the surge, and when we are continuing to see the surge, we have had rallies, we've had festival fairs, etc. So what is the most likely scenario over the next 2 months in Karnataka in terms of spread of COVID-19 cases?
See, I would like to say, Chetna, that definitely wherever there are crowds, especially in closed spaces, the transmission is going to be very high. That we have to remember. Second, I think the general psychology is people are tired at the end of 2 years of being subjected to a lot of restrictions. This is festive season. So it will definitely result in increased number of transmissions. There is no doubt about it. The severity of the disease is going to be less, but that gives no room for complacency whatsoever. I think that we have to remember.
Okay.
Any variant comes, I've always maintained that it does not penetrate a mask. So use of COVID appropriate behavior is very, very important, more so now. Number two, avoiding unnecessary activities of going out is something that people should practice for a couple of more weeks. Because one thing we know about Omicron is the rise is very sharp, the peak is short, and then it comes down as fast as well. You look at South Africa, it's almost, it's on the decline to a great extent. So I think these are times when all of us have to keep this in mind, that we have to slow down our activities on our own. Whatever restrictions are imposed by government, we have to be responsible and impose restrictions on ourselves. Having said all this, the Indian Institute of Science and Indian Statistical Institute scientists have been doing a great job on the modeling for the state of Karnataka. And their predictions are that Bangalore will probably peak towards the end of this month. But like in the first and the second wave, it is going to move out of Bangalore to the districts. And that is where festivities, travel, and rallies is going to contribute to migration of the virus from being a Bangalore-centric epidemic right now to the other districts.
When is this?
So they classically, if you see the first and the second wave, other districts are usually 1 to 2 weeks behind Bangalore.
Okay.
If Bangalore is going to peak, let us say in the last week of January, which is what it looks like, then other districts will peak mid-February.
Okay.
So that gives a lot of time for district authorities to take appropriate actions in terms of preparation of COVID care centers and probably being ready with hospitals, even though hospitalization is like to be less likely, but still one has to be prepared.
So the positivity rate, the test positivity rate even in districts is going to be as high as Bangalore, or can we expect there are some kind of differences now when you look at the districts, there is this difference, but then we're slowly getting there, I think. But will it be the same, and will it peak at the same time, and will it have a trajectory at the same time? How will it?
It is a very, very evolving kind of, in this pandemic, we know it evolves slowly, it unfolds slowly. Test positivity rate would largely depend at this point of time on how much people adopt COVID appropriate behavior. Okay. If people in the districts realize that, yes, we don't want to go the Bangalore way, we will all be responsible, then we may see positivity rates less than Bangalore. Okay. Bangalore, as you know, has already crossed double digits.
Correct.
In terms of test positivity rate. So I would expect that most of the districts would also reach double digits in terms of test positivity rate. There are already 6-7 districts that are inching towards a double digit if you look at the war room data. Yeah. So other districts are no different. People hopefully will be more responsible. That is the only factor that will determine how much the surge will be in each of these districts. In terms of immunization, we have done, as you said, we have done very well across Karnataka. Although a couple of months back, there were some 5-6 districts which were not, reaching the 90-95% mark for first dose. Now most of them have, almost all of them have.
Yes.
So I think that way we are better off in terms of morbidity and mortality expectations from these diseases.
So you're saying that the third wave, the trajectory may start sometime in early March or by end of February. I mean, if we go by what IISc and IIS has predicted, I mean, the projection, what they have given, going by that.
I would say end of February, we will see decline as a whole state. Okay. Bangalore will start declining much earlier. Okay. And it will probably trail into March, 1 or 2 weeks of March, but that will be the tail. And how long the tail will wag, it's very difficult to say that, because we know the Delta tail wagged for a very long time. So,
yes.
So we'll have to wait. Looking at USA, it looks like the tail will be long.
Okay.
But let's hope it is not.
Okay, now that we know that it is a Omicron driven wave, I mean, all said and done, but our genome sequencing is still, we're looking at international travelers, we're looking at clusters. So now what is INSACOG thinking? What makes sense now to do? I mean, it won't humanly be possible
INSACOG is also, INSACOG is also changing its strategy. INSACOG is now going to focus on hospital admissions.
Okay.
It will continue to watch variants and look at clusters in newer areas. For example, it's now all metro-centric and city-centric. Once it starts moving strategically, a set of samples in a new area, if there is a cluster, one should look at that. And of course, the other categories like children, also one will be on the radar of INSACOG. But main thrust is going to be on hospitalized patients with different grades of severity of COVID that we are going to see.
So what are we trying to do with this data of hospitalization? What are we trying to figure out from this?
Clinical correlation of genomic sequencing is very, very important. And also to look if there is evolution of the lineage. As of now, predominantly Omicron lineage is producing more or less, you can say, mild forms of disease. Okay. But if it does produce severe disease in certain individuals, that will give us some insights into whether comorbidities are responsible or whether the lineage itself is evolving further into sublineages, because there will be mutations continuing to occur in the lineage, and whether they contribute to clinical severity would be very interesting to look at.
Okay. So that was my next question. I mean, we have now known that Omicron itself is evolving. So how many lineages have we seen now, and predominantly, and in Karnataka, have we seen those kind of lineages here?
Globally, if you look at, because I have been associated with the development of a RT-PCR kit known as Omicron, and there continuously every day we do variant watching, and we know now that apart from B.1.1529, we now have BA1, BA2, and BA3. BA2 and BA3 is being increasingly reported from some parts of India, Northeast, Rajasthan, and some other places. We are getting these sublineages. In Karnataka, as far as I know, but I've not kept touch with the last 1 week because of pressures of work, it has been predominantly the Omicron 529. A couple of them have been BA2s and BA1s, as far as I know.
Are they clinically different, sir?
Clinically, do they present so different? There is no clear-cut evidence to say that between the lineages, the clinical phenotype, as we call it, is different between the lineages.
Okay. So now Karnataka. Okay. So Indian government has also done quite a few sero surveys in the past, and Karnataka, though, is still slow in terms of doing a sero survey for various reasons. How much do you think it is necessary now with the onset of Omicron variant, which is spreading so fast? So does it make sense to do a sero survey now?
In my opinion, no.
Okay.
Not in the midst of a surge. Sero surveys are best suited for in-between surges.
Okay.
It would have been nice had we conducted a sero survey post-Delta somewhere in August, September, but we could not do it for a variety of reasons, I guess. Right now, there is no need to do a sero survey. Plus, it's also going to be compounded by the fact many people are also started receiving precautionary dose, and we have started childhood immunization. So sero survey at this point of time, I don't think is a good idea scientifically, in my opinion.
Okay. Sir, I know you've been continuously telling many times to the media that SARS-CoV-2 is full of surprises and you don't know what is going to happen in future. We don't know whether there is going to be a new variant, but still it is the question which is lingering on everybody's mind. How many more days do we have to continue going with these booster vaccinations, or whether do we have to, whenever there's a new variant, is it necessary that a new vaccine has to come? Is this going to be the end of COVID-19? And, are we going to see more variants coming in, more deadlier variants? What is the scenario going to be like? And when can we expect this to kind of settle down?
I wish I could give you an answer. Honest answer is, I don't know.
Okay.
But the way Omicron is spreading, it is definitely going to give a booster kind of effect to all those who are vaccinated, as well as, the unvaccinated will also, if they get infected, have exposure. So to that extent, we should expect that for some time, at least after this wave subsides, there will be a lull. Again, I hope I am right, because we all knew a third wave was coming, and that was very well known, looking based on what happened during the Spanish flu a century ago. So the Spanish flu subsided after 3 waves. Let's hope this also subsides. But having said that, this virus can surprise us. Evolutionarily speaking, as a virus goes on mutating, what we know, at least with some of the earlier respiratory viruses, is that this disease severity will come down because it gets more adaptable, and eventually it should become endemic like a flu. So vaccinations, whether we will go on continuing, my own guess is maybe after another precautionary dose, as we call it in India, and a booster, I think there may not be necessity to go on tinkering with the vaccine. Okay. We know one thing with Omicron, vaccines did help in terms of preventing severe disease. But vaccines, it's a tall order to expect they will prevent infection. And those kind of vaccines probably will be available as a nasal vaccine, which in early phases has been showing tremendous promise. And those nasal vaccines are probably the ones that can, if at all, give within quotes sterilizing immunity.
Okay. So coming back to one last question, probably I have 2 more questions. One is about the Omicron kit itself. It looks very promising, and also it can detect the mutations of the Omicron itself, right? The lineages of Omicron, which makes it clinically also. I think now doctors are suggesting to decide on what treatment they have to go to, they need something to tell them whether it is Omicron or Delta or what variant it is. So how will this help, sir, in terms of managing it clinically?
This is a question that has been asked a number of times in the last 15 days too. What is the relevance of Omicron? How does it help? Let me take that question and answer it. It is a RT-PCR that can detect Omicron variant specifically. It also detects SARS-CoV-2 that is not Omicron. So in a test, you are getting the answer. Is it A, SARS-CoV-2? B, if it is SARS-CoV-2, is it Omicron or not Omicron? Okay. This has, as you said, clinical relevance, especially in those who are hospitalized, to know if it is Delta or any other variant. Okay. Delta is still around.
Yes.
I was talking to Dr. Rajesh this evening on another program, and he tells me that Delta is still around in Mumbai to the tune of 10 to 15%. That is useful information for a clinician because we expect more complications with Delta. Secondly, there is this availability of a monoclonal antibody cocktail, which some people who can afford it are using. But we know that those cocktails will not be greatly effective against Omicron because it has many, many mutations in the spike protein compared to other variants. So that is useful information. So some of the clinicians I've spoken to have told me this knowing whether it's Omicron or not has relevance in that context.
Okay.
The next use of Omicron I see is whenever it is introduced into a newer area, for example, into districts where you suddenly start seeing clusters. So you want to ask the question, is it Omicron? At least to know for sure that this is the same virus from a main metro is spreading to the districts. There it has helpful. In terms of an individual, people want to know if it's Omicron or not, because to many people I have spoken to, it's a great sense of relief if it is Omicron, because they think it's a mild disease. So that is another value. And the last most important, I feel, because having been associated with the development of this platform that created Omicron, if it is not Omicron in an Omicron test, I would take that sample for sequencing, because it could be a sublineage of Omicron that is escaping detection in the test of Omicron, or it could be emergence of a new variant, or it could be any of the other variants known to be circulating. So I think both having a positive result and a negative result, in my opinion, in Omicron, not because we developed the technology, I'm talking to you as a public health person, it will help in variant watching. That's what I believe.
I think that's going to be a big game changer. I mean, if it's there in the market soon, when is it going to be available, sir? When is it going to be in the market?
22nd. There have been a little, there's been a little challenge in getting raw material.
Okay.
Because the primers and probes, some of them are proprietary items with one or two companies, and this globally demand for it. So the turnaround time for synthesis and supply is more than 10 days.
Okay.
And secondly, to our luck, the Omicron kit was approved by ICMR on 30th December, and we got DCGI license early this year, 3rd or 4th of January. Most companies in the West closed down for Christmas and opened only on the 7th.
Okay.
So that precious time was lost. Okay. So once the supply starts coming in from now onwards, we are hoping to roll out kits definitely from 22nd in a regular fashion.
Okay. That's some good news to know here. So one last question. Now we know that the spread is definitely dependent on people's behavior. You have briefly explained on the responsibilities of people now, especially districts. But if we have to summarize it, if you can tell us what government should immediately be doing and what people of Karnataka should be doing now.
Well, let's start with people, because I think if there is anybody who has got bashed enough in the last 2 years, it's the government.
Yes.
I was part of the government for many, many years, and I still, at heart, I am a government in my thinking.
I agree.
I think a large part of responsibility rests with people. First is to wear a mask properly. That is very important. B, unnecessary travel and going out into crowds should be avoided, at least for 2-3 weeks, so that one can protect oneself. The good news is that this is a very short peak, and it'll move on faster. So to that extent, if we can avoid unnecessary activities that can result in a high risk for acquiring infection, those should be avoided. Those are the two things I would say. Variant or no variant, viruses don't penetrate masks, provided you wear them properly and you wear them at the right place and you wear them always. Even a small slip can result in an infection. Okay. As far as governments go, governments have to, main responsibility is to keep giving correct information to people. We get the health infrastructure ready in case the virus changes or in case huge numbers occur. Even a small proportion in huge numbers can occupy hospital beds. So be prepared with oxygenation drugs and so on, and COVID care centers for those who cannot isolate themselves. And continue to emphasize to people that crowding is avoidable. And most importantly, have some semblance of some restrictions. If the government does not impose any restrictions, I think it will not be giving the right signals, in my opinion. Many people ask me, this night curfew, does Omicron spread only in the night? The answer is obviously no. I think people like us are not fools when we say it is good to have some restrictions, because in the evenings is when people get together. Whole day they're busy working. It's human psychology to get together in the evenings. So the chances of spread is likely to be more when there is crowding in markets, in places where people go for functions or anything like that. It is mostly an evening activity. Have you seen crowds early in the morning? No.
Less.
Excepting maybe at temples during this month up to Shankranti, right? Otherwise, there are no crowds in the morning. So obviously, where there are crowds, the transmission is going to be high, right? And somewhere, some restriction has to be announced by government. I won't find fault with the government for that. If they don't do that, then the argument is you're not doing anything. If you do, the argument is, I think there is a middle path. As I always say, I give this analogy, COVID itself is like a long road with many road humps. We are at a road hump now. You have to slow down. If you don't, you'll be thrown off your bike or you hit the ceiling of the car. You don't have to stop. Stop is a lockdown. You don't stop in front of every road hump and then clear it slowly. That is not required. But slowing down activities is very important.
Okay, thank you very much, sir. It was wonderful talking to you. And we will hope that your Omicron is here quickly to give us some assurance on, recovery and also on detection. Thank you very much, sir. That is all we have for today. Thank you so much.